Hi everybody. I'm Dr. Caitlin Rigler, and today I have the pleasure of speaking with Dr. Kristine Dalton, an associate professor at the University of Waterloo's School of Optometry and Vision Science. She conducts research and clinical work at the Vision and Motor Performance Lab and the Sports Vision Brain Injury Clinic. She is an optometrist with advanced training in vision science and a clinical and research focus on visual dysfunction following concussion and mild traumatic brain injury. Dr. Dalton will be speaking at the upcoming SNS Symposium, giving a talk titled Visual Dysfunction After Concussion. Dr. Dalton, thanks for being willing to speak with me today.
Thanks for having me, Dr. Rieger. It's a pleasure to be here.
Yeah. So I just wanted to start off and kind of get your take and your viewpoint on what some of the most important things that neuropsychologists should kind of have on their mind and be aware of as it relates to visual dysfunction when working with athletes. Obviously, it's not quite our expertise the way that it is yours. So
Yeah,
what are some kind of key things that we should keep in mind?
I think one of the key things, like big takeaways for me, is that visual disorders following a head injury are actually really common. So people can see clearly, but still have issues with how their visual system functions. That impacts how they concentrate, it impacts how they go to school or work, it impacts how they interact with screens. It impacts their energy capacity to navigate a day because so much of what we do is visual. But when we think of, you might look at a symptom profile or like a set of scat symptoms and they don't report blurry vision, but they still have vision problems, right? And so one of the most common things we see symptom wise from a vision perspective is actually headaches,
Mhm.
right? Headaches are common, trouble concentrating, difficulty focusing, pardon me, issues with driving, riding a bus, issues with moving information. Those are all big flags for me that maybe there's underlying visual disorder present. And so in cases like that, if you're hearing these lingering symptoms and they haven't had eye care services yet, think about sending them to an optometrist or an eye care provider in the space who does concussion work. Maybe as simple as just updating a glasses prescription and maybe adding some vision therapy exercises. Or a worst case scenario, you rule it out and go, it's not vision that's driving this. Let's focus our energy elsewhere.
Mhm. Yeah, so from what you were saying, it almost sounds like maybe our eyes go right to that blurry vision question, but it
Mm-hmm.
might be manifesting in other ways, whether that's
Yeah.
kind of downstream things like headache, but also maybe blurry vision isn't quite capturing their vision
Yeah.
experience. And so, would it be worth adding a couple, obviously not on the symptom checklist, but like in our clinical interview with patients, do you think there's some important things that you feel often get missed? That people could ask right away to help with like initial screening or even providing you information with a referral?
Yeah, you summarized that so wonderfully well. So thank you. I think in terms of what you could miss, I mean, you could simply just ask, are you having challenges with visual tasks, right? Like, are you struggling with screen work? Are you struggling with reading or driving? Um, do visual tasks make you more tired than they might have before? Are you getting headaches after you try to go to return to work? Could that be visual stuff, right? But even just asking about it and paying attention to those other symptoms, those secondary downstream ones like headaches, issues with concentration and focusing. Certainly, concentration, focusing, difficulties reading could be language processing, could be speech, could be all sorts of other things. But it could also be vision issues, meaning I just can't keep the page clear long enough to read comfortably.
Hmm. Yeah, so really, doing what we do best with our,
Yeah,
clinical interview and getting some of the more specifics based off of that initial screening of symptoms.
yeah.
Yeah, awesome. And I know that you've also done some work with parasports, specifically focusing on the Paralympic classification for athletes with vision impairment. I know this is going to be an
Mm.
area that's going to be really interesting to all the attendees at the conference. They're going to want to hear a ton about this. So can you tell us a little bit about your work with that and what would be kind of neat for us to learn?
Yeah, so the classification piece is near and dear to my heart and super exciting. It was kind of my foray into parasport. I started doing some work I look back, it's 2015 that I started working in this space and partnered with para alpine and para Nordic skiing, trying to understand how vision is related to skiing performance and how we kind of group athletes equitably based on the severity of their visual impairment, so that they can compete equitably and fairly. And also looking at, do we need to change what is the minimum eligibility criteria from a vision impairment perspective to allow athletes into the sport? Um, fast forward through that research, which took me all over Europe and across the US, and I got to hang out on lots of mountains and ski hills. And we, in 2023, actually, we changed the rules within the Paralpine and Paranordic to expand the vision eligibility criteria, so more athletes are eligible to compete, and also to change where the borders fell between the different impairment classes within the sport. I'm super excited because those new rules will be in effect for the games this year. So for the 2026 Paralympic Games, the new rules will be in effect. And I'm actually getting a chance to go watch some of the games this year, which is a dream come true. Um, but we are still working closely with the sports because we're doing some final validation work now to try and make sure that those rules are as appropriate as possible for the sports. And we may need to tweak them one more time based on more data that we collect. But that work is still ongoing, and I'm excited to see where we get to.
Yeah. Yeah, it'll be really awesome by the time the SNS symposium comes around to kind of get your input on anything that like you've observed in advances, right? Because
Yeah,
it sounds like this is something that's constantly you're kind of working on and doing advocacy around. So I know everybody will be interested to hear some updates on that.
yeah, it's a super cool space. The other space that's really important is actually understanding how people with vision impairment are affected with the concussion, because
Right.
for many of them, blurry vision or double vision, or maybe nystagmus is their normal status quo pre-injury. And so, trying to understand that's another piece of my research is trying to understand how these individuals experience concussion and how that's different and how we might manage it in a different way for these individuals. I've been working with some of your fellow members in this space, but in all parasport spaces, physical impairment, intellectual impairment, hearing impairment, and vision impairment, we really don't understand how head injury really impacts those journeys. But we are starting to realize that those athletes are at equal, if not greater, risk of head injury, and so we really need to think about understanding concussion and making our concussion research more inclusive as well.
Yeah. Yeah. And kind of going beyond our standard questions, being able to
Mm-hmm.
get a sense of what is actually a meaningful change as opposed to if
Mm-hmm.
that's somebody's baseline or
Yeah.
starting level, how is that
Yeah.
impacted and how can we get at that? So, yeah, that sounds really, important to all different types
Mm-hmm.
of like accommodations and needing to understand how does this impact different people differently.
Yeah. Absolutely.
All right. Well, Dr. Dalton, thanks again for speaking with me today. And I know I'll be looking forward to learning more about visual dysfunction after concussion at the SNS Symposium in Cleveland this May. Those who are listening can read more about the conference and register to attend on the SNS website, sportsneuropsychologysociety.com. You can also follow SNS on Facebook and Twitter, and we're looking forward to seeing everybody at the 14th Annual Concussion and Brain Health Symposium, which is going to be May 14th to 16th in Cleveland, Ohio this year. All right, thanks, everybody.